Hi, good morning Camille. My name is Denise Dominique. I'm your invigilator for the OET-speaking session on the 5th of March 2020. How are you doing?
Hi, good morning. I'm good. Thank you for asking. How about you?
Well, I'm great. Can you tell me your full name for the record, please?
My full name is Camille Call.
And what is your candidate number, please?
My candidate number is 211333140.
Thank you. And you are taking this test as a nurse. Is that correct?
Yes, correct.
Thank you. Can I see your ID, please?
Sure. Here it is.
The warm-up questions are not assessed and are a chance for us to get used to each other's voices. We'll just talk for 2 to 3 minutes.
All right.
What factors led to your decision to choose nursing as a career?
I have always cared about people, and this profession is all about helping others. I enjoy interacting with my patients, and the challenges of attending to their health care needs. Sometimes, it can be very frustrating, especially when the doctor and I are not able to resolve a patient's medical condition. However, seeing the gratitude on the patient's face makes it all worthwhile. I can't think of anything else I'd rather be doing.
How involved were you with patient care during the COVID-19 pandemic?
Working during the pandemic was one of the most challenging things I've ever done. As you are probably aware, nurses were on the front lines and had to put in long hours in tough circumstances. Additionally, we were putting our own lives at risk by exposing ourselves to possible infection. What got me through it was the camaraderie of the entire hospital staff, as well as the knowledge of how vital our work was. I am now confident that no matter what happens, I am strong enough to face it, and able to get through it.
What is the most rewarding thing you enjoy about being a nurse?
The most rewarding part of this job is seeing patients progress from a severe illness to total health. A lot of the work I do is routine and often goes unnoticed. Even when we alleviate a patient's medical issues, they often fail to express their gratitude. However, on occasion, I look into a patient's eyes after we have healed them, and I can see the gratitude they feel along with the relief of being healthy again. If this happens once a week, it is more than enough to keep me going.
What would you do if you witnessed a fellow nurse administering a medication that wasn't ordered by a physician?
This is an interesting question, because it happened to me once. While on duty, I noticed a nurse administering medication, and I was sure the doctor had not prescribed this for the patient. I knew I had to stop the nurse from administering the medication, until we were able to confirm that it had been ordered. I immediately approached the nurse, and asked them to confirm that the medication was ordered on the patient's chart. Once they did this, they realized they had made a mistake. They were grateful for my intervention, and we both learned to double-check the patient's chart before administering any medication.
What do you do to take care of your health, so you can show up to your assigned nursing shifts?
Maintaining my health is critical in this profession. I need to be at my best when administering care to other people. I do this by eating well, getting enough sleep, and exercising. I also pay attention to my mental health by performing yoga and practicing meditation.
Great. Thank you very much for sharing that. So, let's move on to role play now. I'll take the part of the patients, or perhaps a relative, and you'll take your professional role. The purpose of the role play is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the role play as possible. Do you have any questions?
No.
You have up to 3 minutes to prepare the role play. You will start the role play after that time. I'll let you know when 3 minutes are up. You can ask me if there's anything you are not sure about, and you can make notes on the role play card if you want to. Here's a pencil for making notes.
Thank you.
You can look at the card during the test, but you must return it to me at the end of the test. Please start preparing now. Thank you. Your preparation time is over. You can now start your roleplay. Don't worry if I stop you when the time is up.
Hello, good morning. My name is Camille Call. I am one of the nurses in this ward. How may I help you today?
Good morning, nurse. I am here to discuss my father's condition.
I am glad to help you out. Before proceeding further, how may I address you?
You can call me Denise.
All right, Denise. May I know your father's name, please?
My father's name is Dominique Stephane.
For confirmation, Dominique Stephane, 78-year-old, currently recovering for stroke. Am I correct?
Yes, nurse.
Okay, Denise. May I know the reason for your visit, please?
Nurse, I am a bit concerned about my father's recovery.
I know how hard it is for you to see your father in partial paralysis and with the loss of functionality of his right arm. Perhaps, 4 weeks before, from his initial days here in the ward, till date, he has been recovering from stroke pretty well.
Oh, I see. Nurse, I am curious to know about his recovery time.
I appreciate your curiosity. However, the point you should remember is that it was a life-threatening accident for your father. And he successfully overcame the situation. From such a life-threatening severity to a full recovery, definitely will take time.
I realize your words. How can I help my father in his journey of recovery from the stroke?
The reality is that your constant support and help is required, and moreover, it is inevitable for your father. Before explaining about it, may I ask you a few details about his stay after the discharge?
Sure, nurse.
I would like to know the details of your father's living arrangements. Details like, with whom he will be staying, the type of property, usage of stairs he might have to encounter, and so on.
Nurse, he will be staying with me in my independent house here downtown. Well, it is multi-storied, however he can use the room downstairs. So, he can access the living room, courtyard and dining room. Also, no stairs to be encountered by him, which will ease his mobility.
Thank you for your information. From your briefing, this will be an ideal stay for him during his recovery period.
Okay, nurse.
Now, I will outline the patient's care plan for you. Shall I proceed?
Sure, I would like to hear it.
That's perfect. In the care plan, assistance from different areas of healthcare plays crucial roles. I will explain it one by one.
Okay.
First being occupational therapy. You might have heard about this. Well, no worries, I will define what it is.
Thank you.
Occupational therapy is a branch of healthcare that helps people of all ages who have physical, sensory, or cognitive problems. Occupational therapy can help them regain independence in all areas of their lives. That is home and activities of daily living.
Oh, I see.
After stroke, since your father is in partial paralysis and has lost the use of his right arm performing, occupational therapy is essential and can help regain the functionality.
Okay.
Not only that, but also to do the assessment of his condition and progress, and to make him capable of adapting to the present disability he is facing.
I got it, nurse.
Great. Then comes the physiotherapy. It is to develop strength and enhance mobility.
Nurse, occupational therapy does a greater focus on his physical ability. In such a scenario, is physiotherapy really essential?
Your thoughts are sensible. However, I should say that physiotherapy is very much essential. Don't get confused, I will explain it to you.
That will be very helpful.
As you know, physiotherapy enhances muscles and its activities, thereby strengthening the limbs. But, it is not the only benefit the physiotherapy is providing. A stroke-recovering patient will be adherent to the medication regimen for blood pressure and blood-thinning medication. In this process, physiotherapy plays a crucial role by enhancing blood circulation. And thus, these medications will be more effective with physiotherapy. I hope you understand the relationship.
I understand the importance of physiotherapy.
Happy to hear. Well, is there anything else I have to explain to you?
No, nurse.
Okay. Denise, I will provide some information about the support available for family and patients suffering from stroke recovery. There are some community groups and centers which will aid services and support. This will be a great help for you and your father in the journey of recovery from stroke.
Thank you very much, nurse.
You are very welcome. Please, feel free to contact us in case of any assistance needed. I wish your father a speedy recovery.
That is the end of your OET-speaking roleplay. All the best.
Thank you. Thank you for watching. Please, like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.